We got Seth. All right. Welcome, everybody, to our Groundhog Day edition of Weekly Report Outs. Punxsutawney Phil saw a shadow this morning, so we have 6 more weeks of winter. This is week 8 and call number 51 of these regional report out calls, I believe, if I'm doing my math right. And this is the South Central region, which we've been here every Tuesday at 1:30. And I'm pleased to report, as the numbers have gotten better, the leadership in the state is comfortable with us going to an every other week format on this. So our next call will be February 16th, and then again on March 2nd as we do these. I really want to encourage you to go to our website, covid.ks.gov/report-outs, and sign up with your email so you don't have to remember 2 weeks from now that we're doing this, try and tune in live. If you sign up for the South Central region, this will come to you as soon as we're done with it. covid.ks.gov/report-outs. There you go. Let's start with the dashboard. And let me get that pulled up here first to share the screen. All right. So here we're looking at the South Central region. And, the high level news across the state as things continue to get better. We can see the critical staffing shortages, still issues out there around staffing, but continues to improve from where it was. Also improving, when you look at hospitalized, confirmed, or suspected COVID patients, we're down at 209 in this region, down from 271 3 weeks ago and 248 last week. So numbers are going in the right direction. I'm largely hearing across the state from hospitals that most of them are at 40 to 50% of COVID patients from where they were in their peak in December. So that's good news. The number of COVID patients in the ICU in the South Central region is at 52. Last week that was at 70. So continuing to improve there. And then adult ICU beds available were at 54. Last week we were at 44. We've been hovering kind of in this range here for a few weeks. This is a little better than what we've seen over the last 3 weeks, but still 19% capacity. A lot of need in the non-COVID world, which is normal this time of year, but that's what we're seeing. Coming down here to the case count, you can see our peak here in November. And then what we've seen is this nice steady decline over the last 4 weeks. The positivity rate was at 8.6% last week. And as a state, we were at 6.44%, which is the lowest I've seen since the end of September. I heard on a call with Dr. Norman today that at our peak, we were around 2,500 new cases a day. Today, we're around 650 new cases per day, which is good. So things just continue to move in the right direction. I'm going to flip over to our this wonderful site, kansasvaccine.gov. If you click on data, you can again see this. This continues to increase. Now 6.4% of the state population has received at least a first dose of the vaccine. You can see a first and second doses. And I got a call from the Northeast region. These now include the federal long-term care facility program, which has been programmed through CVS and Walgreens nationally, and getting into those long-term care facilities. I'm hearing as a state, I don't have it for the region, that we're about 3/4 of the way through the long-term care patients in the state through this program and gaining ground every week. And I think they'll have everybody by the end of the second week of February on that. So, and again, this is just great data on here. Pfizer, Moderna, age, shots per day, first and second doses, and then, what's going on in the different parts of the state. You'll see Sedgwick County here at 5850. That's what Johnson County was getting. I looked at like Butler and Reno were both at 900. But just some great stats here on this website. And they do a good job keeping it up to date. So I'll stop sharing and reading numbers. Let's talk to the people that are really on the ground that know what's going on. And our beloved Seth Conkle is here with us to give an update from the public health perspective. Seth?
Yeah, thanks, John. I think the numbers speak for themselves. Things are turning around, um, and kind of heading in the correct direction. And I think that's what we definitely wanted to hear. I think one of the metrics that I use personally just to look at it is more of a visual, county by county. And I was happy to see today when I logged on that we only have 4 counties in the region that are still considered in that red criteria, and then we have a handful in the green, and most are there in the yellow. So it wasn't that long ago that everyone was in the red, or nearly all the counties in the region were in the red. So I think it's definitely a testament to people taking social distancing, taking masks, and taking other things to heart. I don't think we can stop that. That's, I think, what we've seen this before, where we would have a dip, and then everybody gets comfortable and it's gone. It's not as big a deal anymore, and then we get a little bit lax in our precautions. And again, while that vaccine numbers are looking good, again, we're still only at 6%, or right at a little bit over 6% of the entire state being considered fully vaccinated. So we're nowhere near where we need to be for that vaccination to be effective for the entire community. And therefore, those precautions are going to have to continue. I think in the South Central region, one of the things that we're continuing to see is just we can use more vaccine. I think we've got communities that are willing, able, and capable of giving more. And I talked to somebody today where the vaccine that their health department is anticipating over the next 2 weeks is already accounted for, based on the fact that they're using like a waiting list. And so again, every county is doing something a little bit different. So if you're not sure what your specific county is doing, either for testing, it's still an option, and or vaccine, I would definitely check with your local health department. If they aren't doing it, they will know where those services are within the community and can point you in the right direction.
Great. And so I just want to point this out because can't hammer this point hard enough. It is a supply side issue right now. And so, for instance, how many people in Sedgwick County fit in the phase 2 realm of things?
It's been a long week already, and I think it's like 100, like almost 100, 112 is what I want to say.
Yeah, I think that's what I've heard also. And
Um,
we're clicking at about 6 to 7,000 doses a week. And so you can do the math on how long that's going to take. So it's not necessarily an issue of it sitting on shelves and waiting to get out. It's just that it's coming in slow right now. And the counties are getting organized and trying to get it out as fast as they can. And it is important to check your county's website. So Sedgwick County, I know, for instance, Seth is working by age, right? And so we're still at 80 and above right now. So they're trying to look at the most vulnerable and work their way down. Would that be right?
yeah, absolutely. And I think that was the nice piece that came from the state was the guidelines are there within the 5 phases, 1 through 5. And then the counties each have their own ability within those phases to determine how and who they use their vaccine on. Just it makes it a lot easier at the county level to make that decision. They know who's most vulnerable in their populations. And so they are looking at that. Again, with that very limited, Sedgwick County has elected to start at the high end of that 65 and older and come down, whereas other counties, perfectly acceptable, are serving just 65 and up, and or they may have said it's 65 and up with chronic conditions. So everybody's taking a slightly different approach, and that's fine, because the whole goal of this is to get vaccines in arms within a week. I think that's kind of been the challenge from the state, is that we would like to see those vaccines off the shelf within a week. And if you can do it even faster, that's even better.
Yeah. A lot of them are turning them around in 2 or 3 days, I think, is what I'm
Yeah.
hearing. Yeah. That's great, Seth. Well, let's hear from Dee Dee to give us an update from the hospital perspective.
Yeah, can you hear me okay?
We can, thank you.
I'm Dee Dee Duell. I'm from Ascension Via Christi, and I serve in outreach overall in my role. And for the purposes of these calls, I am representing counties and about 31 hospitals. And John already made some good notes about from the hospital side as far as it relates to the dashboard. The ICU bed utilization is just something that kind of we continue to kind of keep our eyes on. It looks a little different from day to day. I know last Friday it looked like we were in high usage of ICU beds, and then by Monday it changes. So as we know, those change a lot. But keeping a careful eye on that, and the fact that these are mostly non-COVID patients now, and I think what we're seeing, some of that contributes to that is maybe just sicker patients. We've got some sicker patients with longer hospitalization, maybe from some delayed care during the pandemic and that sort of thing. So I think maybe there are patients that just need a lot more care and are in here a little bit longer. So watching that, we're hoping now with the numbers going in the right direction, and they continue to do so, that's going to free up more bed capacity and free up the transfer capabilities that we have, especially here in Wichita. And hopefully Dr. Watson can speak to this and affirm some of that, in that we're easing up on that. And so hopefully hospitals feel encouraged to know that they may have a little bit easier time spent in trying to get patients transferred to the next closest place that is the best for the patient and their family. John spoke to, the dashboard talks about the critical staffing shortages. And while we really aren't seeing, maybe not reporting a critical staffing shortage, it's just very worthy to note that just because we may not see a critical staffing shortage, that doesn't mean that staffing challenges don't exist, and they always will. And they, especially in the rural areas, existed well before the pandemic. And even if they may not have staffing challenges currently, that doesn't mean they don't have staffing concerns. And what I mean by that is there are a lot of, and I just met with a network of chief nursing officers last Friday, and every one of them spoke to the fact that, yeah, we might be doing okay on staffing, some weren't. But they're very concerned about their staff, and they've been at this a long time, and they're weary and they're tired. They're asking for a break. They want a vacation. They're worried about their mental and emotional health and what that's doing to them, and really trying to watch carefully the behavioral health side of this and what that's going to look like now that people maybe can breathe a little bit. But then trying to give people a break is a challenge, because it's very hard to get agency staffing, especially in the rural areas. It's extremely expensive, and they're competing with the urban areas to try to get those people, and they're not going to come for anything less. So those staffing challenges still remain no matter what. I think most hospitals now are just really focusing on the vaccine and doing everything that they can to support their local health department with resources or whatever they need to do to partner. I know each county, each area is doing something a little bit different. So the hospitals try to just be the very best partner they can to help with those resources, and then just wait for more vaccine to get there so they can actually get them in the arms. I think all of this stuff, again, everything going in the right direction is very encouraging, but absolutely, as we will, keep saying, and everybody gets sick of hearing, but we just cannot take our foot off the gas pedal here. Don't get comfortable. We've got to continue to take all of our precautions to keep ourselves and everybody else safe. And, I just would like to point to the CDC recommendations for Super Bowl. Pay attention to that. Try to do something a little bit different and not have those big gatherings, and keep yourself safe so that we don't have to experience any kind of spike after we all celebrate the Chiefs win, right? So I think that's all I have.
Thanks, Dee Dee. They actually, some researchers really believe the Chiefs winning the Super Bowl last year saved lives because the coronavirus was already going around in Northern California and San Francisco. And had they done the Super Bowl parade there, they think they would have had a super spreader event early. And since it wasn't as prevalent in Kansas City winning actually helped delay that. And so, the Chiefs are all about saving lives. And I think it's a good point to make that you don't want to put yourself at risk because you're going to want to yell, you're going to want to cheer. And so just be thoughtful about how you choose to consume and support the game this year. We got Dr. Watson with us, one of our favorites, to give us an update on what's going on with the transfer situation. Dr. Watson?
I love that rationale on the Chiefs. I think that was brilliant the way that was pulled together. I hope so. Could you make me presenter?
Oh, sorry about that. Yep.
Yeah, well, honestly, Didi's right that the capacity in the system as a whole affects the capacity of the system, certainly at the urban centers as well, and that's what we're seeing across Kansas is this now we're really a lot of green, a lot of yellow, and very little red. So I think overall good news. And even though we did have a little bit of increase in hospitalizations at one point, it was easily absorbed by the system, which is where the problem comes. I mean, we can absorb variations in volume as long as we're just not so close to the edge that we don't have any margin whatsoever. And it is tough staffing and realizing that over the long haul, people need vacations and rest. So the current trend is continuing down. Fewer and fewer percentage of COVID patients. Where's the bottom here? Where are we going to find sort of the background? Probably around the 5 to 10% mark is going to stay that way. The transfer times have gotten much more reasonable, right at an hour for non-COVIDs, and then just a little over an hour and a half for COVIDs. And again, these are numbers that we're seeing this trend that's just dropping lower and lower, and really think it's due to in the course of the virus, certainly the season of it, the fact that the mitigation efforts are still going on, and then also the background of having vaccine in place. It's a constant reminder to people that we are still active in this, and hopefully that there's a reason to continue to do. Light at the end of the tunnel always seems to improve everybody's compliance. When it seems like it's hopeless what you're doing, then we tend to stop that activity. So a lot of good news on the forefront, and I do think that we're going to go into the spring looking good. Hopefully the vaccine's going to provide the extra oomph that we don't have much of a spike in the spring at all.
Thank you, Dr. Watson. Hey, Seth, just out of curiosity, when thinking of Sedgwick County, because that's what you can speak for, do you know, are many of the counties or Sedgwick County partnering with the hospital or healthcare system, or are you guys dispensing it yourselves through Intrust Bank Arena or public health sites? What's that been looking like in this region?
Yeah, so right now, because of the limited number of vaccines within the state, at the state level, it's going to local health departments, and local health departments are encouraged to, if they can't handle it, they'll obviously partner it. Again, right now, I think that, for decades, this is what I did for the health department back starting in 2002 was help planning for mass vaccination, mass dispensing sites to dispense antibiotics in the event of something like an anthrax attack. So I think health departments have been well funded in this area to create plans and have requirements to test these plans annually. So this is definitely in the wheelhouse of public health, whereas testing was something that was completely new and not generally something that the public health does on a mass scale. So I think right now, with the very limited number of doses we are seeing across the state, that it's just staying at the local health departments in most cases, but know that there's a ton. I think there's almost, I haven't seen the list in a couple of days, but there were well over 1,000 providers that maybe close to 1,200 that have signed up in the state that are willing to vaccinate. So I think we've got a good footprint, and we'll continue to expand that as we need to.
Great, thank you. So make a note there. Okay, well, any final comments anybody wants to make before we wrap up here? Dr. Watson. All right, that's great. So these calls, they'll probably get a little shorter, but we want to keep them alive just in case we see something that we need to report on, give a beat on what's going on with the vaccines in the region. Again, it'll be moving to every other week. Encourage you to go to our website, covid.ks.gov/report-outs. Put in your email address, February 16th, then March 2nd. We'd like to end with a bright spot. While we're talking about the Chiefs, why not? So NFL, if you haven't heard, is getting a lot of frontline COVID-19 workers into the Super Bowl that have been vaccinated. I think 7,500 across the country. University of Kansas Health Systems got to pick 18 healthcare workers, as KWCH reported on. One nurse from Hayes Medical Center named Kelsey got selected. Huge Chiefs fan. I'm excited. Doesn't feel real. Never imagined I'd get to go to the Super Bowl, but this is great. She's never been on a plane, never seen the ocean. So how cool to get to do all these. I just love these stories about these healthcare workers getting to do it. They've done so much for everybody all year. And just a neat thing the NFL is doing, and glad there's going to be some Chiefs representation there among that. And of course, if you're a caring person like most healthcare workers are, you're probably cheering for the Chiefs anyway. So maybe all 7,500 being red. So anyway, that's my little side note. Hey, appreciate everybody. Thank you. Dee Dee, Seth, and Dr. Watts, and everybody who's been so committed to making these happen over time. Served a role through a critical 2 months. Please sign up with your email address to continue to get these. We'll keep them as short as we can, get the information to you so you can go on about making your community great. All right, everybody. Thanks for a great day, and wish you a wonderful February.